So let's face it, there's a lot of confusion out there between filler and fat grafting. I'm here to fill you in with the facts. I'm Dr. Andrew Campbell. I'm a double board certified facial plastic surgeon. I've been doing facial rejuvenation surgery for about 27, almost 28 years, and I specialize in deep plane facelifts and comprehensive rejuvenation. Part of comprehensive rejuvenation oftentimes includes fat grafting, so I've done a lot of fat grafting over the years. It is a wonderful tool to use for patients who need a pretty significant amount of volume. And that is really the only kind of patient that I tend to fat graft, because if you only need a tiny bit of volume, I think filler does a great job. It's very safe, it's very consistent, and it gives you exactly what you want. I personally use fat more as a base for people that need a fairly significant amount of volume. Like if they're looking at 4 to 6 syringes of filler, I'm going to talk to them about doing something like fat grafting, because they're going to get a lot of volume for a very, very long time, and it's a more reasonable cost when you look at that type of thing over time. So if you don't know what fillers are, fillers, at least at Quintessa, we use exclusively hyaluronic acid fillers. We don't use any calcium-based fillers. We don't use any methyl methacrylate fillers. We found that the hyaluronic acid fillers are very consistent. They're very long-lasting. They're very natural because it's the same substance that is in and around all of our cells, and so our body really can't react to it. They do cross-link it to make it last longer, but some of these fillers can be, like in certain areas, like under your eyes, you could have multiple years of longevity with pretty standard filler, hyaluronic acid filler there. The upside of hyaluronic acid filler is, well, one, it's easy. It's just something that we can take off the shelf and we can inject into almost any place that we would want, including in the skin. So like for wrinkles, you can actually get it in the skin, whereas fat grafting, you can't. It's under the skin, you're using it in large volume. Filler also can be dissolved. So if somebody doesn't like their filler, you can actually use a different agent and it will literally dissolve it in a matter of a day. That's wonderful, especially for somebody who may want to try something. Like maybe they don't know if they want larger cheeks, they can do filler. And if they really need a lot of volume, then as that filler goes away, they might decide, hey, I'd like to do it for a longer lasting result using fat grafting. And I always tell them, you'll get a longer lasting result and it'll look great, but you may still need little touch-ups with filler, even though we did do a fat grafting procedure. Areas of the face that are really commonly treated with volume, which means it could be filler, it could be fat. I'll start kind of from the top. Temple hollowness is a very common area that we can do filler, and even including some filler like Sculptra can be placed there. You can actually put it in the eyebrow and get a little bit of an eyebrow lift. It's not super common to put it there, but it can be. We can put it in wrinkles between the brows, though that is a potentially dangerous location because it is what's called a watershed area, which means it has a kind of a tenuous blood supply. So if we inject filler in these wrinkles here and we put pressure on those blood vessels, they might not get blood to the skin, and the skin may literally die and necrose. That has been documented well, so most people don't like to put filler there. I will only do it as almost a last-ditch effort for patients, and I'm obviously very careful in that area. Other areas going down would be the lower eyelids for the hollows and the tear troughs. Cheeks are extremely common. As a facial plastic surgeon, we often say this slogan of the mid-face is where beauty lies. And that just means people that have nice round cheeks are more attractive than people that don't. So having nice round cheeks and full cheeks is a very youthful thing, super common area to put filler. Middle of the cheek, almost never put filler, unless it's in some lines that you can actually fill, but most people don't ever need volume in their middle of their cheek. It's usually up high, some into what's called the submalar, but rarely ever in the middle. You can put filler in the jawline, make a stronger jaw, a more refined jaw. You can make a jowl tend to look like it's kind of disappearing and isn't as significant. You can put filler in the chin and give a little bit of a chin augmentation. You can put filler in the lips. You can put filler in the nose, although that's relatively uncommon here. It is a non-surgical rhinoplasty. Those are the main ones. You can put filler in saggy earlobes. You can literally put filler in pretty much anywhere that you would want to add a little bit of volume. Adding it into necklines, it can improve them. Seldom does it make them completely go away. Pretty much anywhere along the face here, you can add filler. Fat, a little bit of a different matter. You can't put it in wrinkles, but you can put it in most of the areas we talked about. Under eyes and cheeks and temples, fantastic place to put fat, pre-jowl, most common areas that I do, and it can last a lifetime. So what is the actual procedure of fat transfer? Well, we have to get fat from the patient, and typically I'll go through the belly button. Most of my patients have some lower abdominal fat, and I literally just use a liposuction cannula like I would use in the neck, and I use it to harvest the fat into a syringe. There's countless different ways of processing the fat. I personally use a very simple method of just a screen and some gauze, and I allow the fluid to go into the gauze, and it will get rid of the excess fluid and oils from the fat that we then put into 1 cc syringes. Most often I'm doing about a 1 millimeter cannula, so it's a very small cannula like the size of a Q-tip, in fact smaller than that. Go in through a little needle poke, and then you lay down little tiny pieces of fat across the entire infraorbital rim, out into the cheek, under the cheek. If I'm in the temples, I usually go from 2 directions. You can come down here right up against the bone, but the key is very, very small quantities of fat placed over lots of different locations so that each of those little strands of fat will get its own blood supply, and then it will be able to survive, and it's going to give you long-term volume. A lot of people think maybe 50% of the fat is lost and 50% of the fat stays. I'm more of one that thinks it's closer to 70% of the fat stays and 30% of it's lost, but I am what most would consider kind of a medium volume fat transfer person. I don't do 100 cc's in somebody's face. I think the far majority of that fat does not survive, and I think people can start to look overfilled. I'm one that's on average somewhere in the 15 to 20 cc's of fat in my average facelift patient or rejuvenation patient, and I feel like a lot of that volume, probably close to 70% of it, stays with that patient long term. A lot of people wonder, how long does fat last versus filler? And let's start with filler. Filler, for the most part, lasts somewhere in the 9 to 12 months period. If it's under the eyes, I've seen it last for years. I've certainly seen cheeks last for close to 2 years. Lips, probably not as long, but if you can get the newer lip fillers, they are FDA approved actually for a full year. A lot of people do get that, some people don't. So lips are probably the least longest lasting. Underneath the eye here is probably the longest lasting, and everywhere else is kind of in between. As far as fat transfer goes, I'm a firm believer that if the fat that we put into the face through fat grafting gets a blood supply and it survives those first couple of months, then it's going to be there for the rest of the patient's life. Very few patients lose all of their fat in their lower abdomen as they get older. Now, if they did, the fat we put into their face would actually diminish as well, and it certainly could do that with weight loss. But most people retain at least a little bit of fat, some maybe more than they want. That fat that's put in the face is also gonna stay there for as long as they would have fat in their belly. Once it gets a blood supply, it's gonna be there forever. So let's talk some downtime. Filler, you literally come into the office, we do some injections. If you're lucky you don't bruise, you might wear a little makeup and you're back that same day, certainly the next day, maybe a little bit of makeup. If you bruise, you have to be pretty good with makeup, but nonetheless, you're back the next day or the same day. With fat grafting, it is a surgical procedure. You're going to have some discomfort in the abdomen from the liposuction. The face really doesn't hurt all that much after the fat grafting has been inserted, but you do get some swelling. And the swelling is on top of the excess fat that we already put in there. In other words, we already overfilled the area with fat because we know we're going to lose some, and then we added swelling on top of that overfilled fat area. So the swelling doesn't look horribly natural. I tell people it takes pretty much 2 weeks before the swelling is down enough and the fat resorption is down enough that the area actually looks pretty darn normal and they actually look really good. Most of my procedures, I tell people 1 week because they can put a little makeup on, they look pretty good. When it's fat grafting or if it's a deep laser resurfacing, I usually tell them it's going to be closer to 2 weeks. So now let's get to the fun part. How much does all this stuff cost? Well, filler is sold by the syringe, and we also sell it to the patient by the syringe. So the more syringes you use in filler, the costlier it could be. It could be literally a few $100s up to several $1,000s, and literally $3,000-$4,000 worth of filler if you were doing larger quantities. Fat grafting, you're somewhere in the $3,000 to $4,000 range, depending on how much we need to do, whether it was done in the office, whether it's done in an operating room. So it could be something that's similar in cost, and obviously fat has a longer lasting result. But if you don't need a large volume of filler, then it's much less expensive to do the filler. The problem is the filler is going to disappear, and a year later you're going to need a little more, and a year later you're going to need a little more, and a year later you're going to need a little more, and at some point you are going to get or exceed the cost of the fat. However, you don't have any downtime with the filler, and you've got downtime with the fat. So we have to take that into consideration when we're discussing cost and over a longer period of time. Like I said earlier, I really feel that when somebody really needs a lot of volume, they're a great fat grafting candidate, because at the very least give us a nice base of volume that we can then add a little bit of filler. Instead of spending thousands of dollars on filler, they can spend thousands of dollars on fat, and then instead of spending thousands of dollars on filler again and again and again and again, they can spend hundreds of dollars on filler to just maintain that little bit or that little nuance that they need on top of the fat grafting. Some people think that filler and fat look differently, but in reality, they really don't. They both serve the same function. They're just volumetrically enhancing a location. When done properly, both should look very natural. You shouldn't be able to tell somebody has filler when it's done properly. So my opinion is they both look very natural. I do agree that fat grafting has its limitations in certain locations. So there are places of the face, like nasolabial folds, lips, where I actually prefer filler. I'm going to tell them get filler and not fat in those locations if that's their main concern. However, if you're getting fat grafting elsewhere, will I put fat there? Of course I will, because we usually have a relatively endless supply of it. So I'm happy to put a little more in these areas, even though I know it may not take as well as, say, the lower eyelids, cheeks, temples, pre-gel. Both look great. Both last a pretty long time. I mean, filler today, and like I said, other locations, 1 to 2 years, maybe longer. Fat, obviously, much longer. But you just got to kind of weigh the pros and cons of each. So there are case reports of blindness with fillers. So from that perspective, there is a very, very, very small risk of a catastrophic complication. I personally have never seen anybody lose their vision from filler, and all of my friends that I've talked to have never seen anybody lose their vision from filler. But we know these case reports are out there, so we're always very careful, especially injecting around this area where there's blood vessels and they can lead back to the eye, which can then lead to an embolus to the eyeball and threaten somebody's vision. The question is fat grafting safer? I would argue overall it is. We're using a larger cannula. The chances of getting that cannula into a vessel and getting fat in there is extremely low, if not virtually eliminated. So I've not heard of anybody going blind using the typical fat grafting techniques, although I'm sure that there could be someone, if someone's using a really small cannula, it could happen. Overall, I think it is a little bit safer from that perspective. However, in the big picture, filler's super safe. It's done with the patient that's awake in an office. It's easy, there's very little to no downtime. Whereas fat grafting, when I'm doing a facelift and I'm doing fat grafting, I'm doing that in an operating room where I take a patient under general anesthesia and we're harvesting the fat, we're processing it, we're injecting it in all these locations. You have to take that small but real risk into account as well. In the big picture, I have no problem with patients doing either one. I think they're both exceptionally safe and give people great long-lasting results. My recommendation is that you see someone who has a lot of experience doing fat grafting and facelifts and filler, and they're going to be able to give you the best option for your particular need and anatomy and desired outcome. I always look at the patient as if I see somebody who I feel needs volume, fat grafting is the way to go. If I see somebody where I don't think they really need volume, but they mention a couple of small areas that they don't like, I'm probably going to recommend filler just because it's so precise, so easy, relatively affordable, and relatively long-lasting and super safe. So I know this can be a little bit confusing. I would just highly recommend that you schedule a consultation and I'll be able to examine you and we can come up with a very customized treatment plan for your specific issues. Don't forget to like us, please subscribe, and if you need more information, just hit the bell. That's the facts on faces.